the Medicare insurance companies make more money off of Medicare Advantage than they make off of selling traditional health insurance. So what does that really tell you?
Which side are you on? Which side are you on?
Ed Grystar is our guest this morning. He has more than 40 years of experience in the labor and healthcare justice movements. He is co-founder and current chair of the Western Pennsylvania Coalition for Single-Payer Healthcare, served as president of the Butler County, Pennsylvania United Labor Council for 15 years. He's also got decades of experience organizing and negotiating contracts for healthcare employees with the Service Employees International Union and the Pennsylvania Association of Staff Nurses and Allied Professionals. Ed, thanks for taking the time to talk to us this morning. I appreciate it.
Thank you.
So, one of our first interviews that we did on the program was with a few PASNAP nurses. So we really liked having them on and think that that's really probably, one of the best unions out there. It's great.
Yeah, I would say PASNAP is a notch above most of the other unions, we would always argue that we're really a different union, but then sometimes we would say that's because the bar is so low, but they are good.
Yes, yeah. We got to get some of them folks back on. In fact, it's been too long. But today we wanted to talk to you about a recent article that you had in Counterpunch titled "Labor Leaders Provide Cover for the Privatization of Medicare." Let's start with a general overview of that article and we can dig in from there. So what is the general thing that you're trying to get across in this article, Ed?
I think the general theme is that Medicare is facing literally an existential crisis. And the existential crisis is the privatization of its services. It's being used as a cash cow, literally, by the same insurance companies who refused to provide services to the elderly and disabled when Medicare was originated in the 1960s. And because there's been an incessant drive to privatize it, literally, this is the 50th anniversary of the inception of insurance companies in Medicare. So Medicare was created in 1965 because there were no effective, reasonable insurance for people over 65. Yet what we see through the decades is not only Republicans, but now increasingly Democrats supporting the privatization of Medicare. And when we say privatization, we mean the insertion of insurance companies, third parties into the relationship and the payers and the doctors and the providers of care to the patients. And I'll end it with this, because when we say we want single payer Medicare for all, what we're really saying is that the insertion of private entities, for-profit hospitals, insurance companies to manage your care provides no value to healthcare. Literally no value. It's a profit making. And my article was exposing that and talking about why labor is in a losing battle if they don't begin to expose this and come out for the public interest. And it's also related to the general crisis inside labor, where I would say, and I'm going to just be upfront, that it's not capable of meeting the needs of the day, where you have the mass of people more in favor of unions. The mass of people, the public, wants to have some kind of healthcare solutions, but we really don't have a movement that is pushing that. And I think that we're trying to articulate that we're losing the possibility of Medicare maintaining itself. And literally, we'll get into this, the Center for Medicare Services has the goal privatize Medicare totally by 2030.
Right. Well, that's, not only You said that the insertion of the profit motive and these third parties and these insurance companies, not only do they provide no value, but you also point out, and it's not just you saying this, you're like reporting from like GAO reports, and this is well known that it's actually in fact a negative value to the consumer, right, to the human who needs this care to survive, but also to the taxpayer, which is the taxpayer is supposedly this thing that we worship in America, right? But let's start with the introduction of these insurance companies into Medicare, and one of the things that you mentioned in your article is that a driving factor in the privatization of Medicare is HMOs. Explain that. What is an HMO? What is the function there?
Well, an HMO was one of the originating privatization schemes. And I think that for the general public, what you have to start back is in the context that they name these devices or schemes in different ways. So an HMO essentially is gathering all of potential patients in a certain area for a certain employer and grouping them together, and then saying that because we have these people in the system, in our insurance company, that we'll be able to provide better care for you. And that was the original methodology used by the privatization. But as you can just go through the history, none of these things have saved any money. So they call them names, and one is HMO. Now we have Medicare Advantage. So that was the first privatization of Medicare, the insertion of an insurance entity into it. As I said, it's simply a third party coming between you, whereas with single payer, with traditional Medicare, you go to the physician, you go to the provider, Medicare pays. Medicare for all, or single payer, is simply a payment system that saves the taxpayers money, rather than have some insurance company, whether it's an HMO or whatever, saying, well, maybe Ed Grystar or Jacob has to go to see another doctor, or he or she can't get this service because we don't think it's necessary. There's immense administrative costs that are associated with all these middle people coming into the healthcare, because they have to be looking at your bills, they have to be looking at everything, as opposed to Medicare, which only has a 2% overhead. Insurance companies' overheads 10, 15, 20%, because all of the ridiculous commercials that you see on TV, call Joe Namath calling you up, or blah, blah, blah. It's all simply a waste of money. Literally, and people say, oh, that can't be true. The answer is, it is true. It's a waste. It doesn't provide any value.
Right. Yeah, I mean, exactly. And that profit, it's a waste. It's a waste in terms of, why are we advertising for these services? Why can't people just go to their doctor and get a recommendation about what type of insurance they need? Or why should they even have to have a recommendation on the type of insurance at all? Why can't we just, particularly the conversations about Medicare, why can't we just have, when you're 65 and older, you get the care that you need, and that's just taken care of? That was the whole shtick of Medicare, is that you don't have to worry about all this nonsense that we have, while you're a working person. And that's the thing that I don't understand, why there's not more agitation about this, because I hate paperwork. And so every year having to decide whatever, this is the kind of healthcare I still want to do this, even though it's going to cost more this year. Like, I don't know why there's not more agitation about that, right? But that we weren't supposed to have to deal with that when we retired. And yet now we are, and they're using this money to not only pay to advertise and all these administrative costs, but also the CEOs are making money. And CEOs are making a lot more money than the head person of Medicare would. And for what reason?
Right. Yeah, and I think, again, you have to look at what is the ideological drivers of this. The ideological drivers are that it can be used as I say cash cow, and all of the research that has just come out. I mean, it's like billions and billions of wasted dollars, profits, excess billing, everything that could be, as you said, transferred back into the delivery of care to the public. And our unions literally are sitting on the sidelines, and they're kind of having, their finger looking in the air or whatever, and saying, well, we don't really know what to do with this. And it's the necessity of us to show and to get some kind of an upsurge, because this has been going on with Republicans and Democrats. I think the last time we checked into it, and one of our demands is Medicare Advantage literally has a Medicare Advantage king and queen show where they have people signing on and saying, we support Medicare Advantage, we're in the Congress. And our point is that it's some of the people who sign on to these things for Medicare Advantage are not some of them. Many of them are Democrats, and many of the same people who claim they support Medicare for all will sign on, say they support Medicare Advantage, which is it's just two polar opposites. So it's time to educate, and it's time to because the crisis is not going to go away, and it's going to continue. And the Biden administration now has just picked up on what Trump started. But if you go back to this, and again, I think people really, especially labor people, working people, not just ones who were in the union, but people who work for a living, they have to understand that in 2010, when the ACA was implemented, when it was voted on, there was inserted in there a special provision that they would establish pilot programs. And all of these pilot programs are essentially privatization schemes called under different names or different anachronism. And their whole essence is to take these pilot programs and then force them literally onto the Medicare beneficiaries. And literally, it's almost bizarre that you could have a program right now in Congress that is privatizing Medicare, ACO REACH it's called, that has no congressional oversight. Literally, it's written into the law. There's no congressional oversight, and there's very little pushback from Congress because half of them are literally bought off by the same insurance companies. Biden got more money from the healthcare industry, the pharma, than Trump. So this delusional idea that somehow everything is bad because that Trump did it, you kind of got to get away from this. We really have to focus on who is behind this. And it's clear that it's both parties. And when I say both, I'm talking about from the inception 50 years ago when Medicare was passed. Keep in mind, when Medicare was passed, it was a tremendous civil rights achievement because all of the hospitals in the South, mostly in the South, had to be desegregated. Literally, they had to be desegregated or they wouldn't get Medicare money. And that was a tremendous victory for civil rights for Black people, and actually in just the elementary provision of healthcare. People don't even know how that all was established. It was a huge fight to get Medicare established, especially in the South, because of what I just said. So now you're literally having it stolen away from you, taken away from you right before your eyes. And the people who should be fighting it are literally partaking in it, and it's just obscene.
And these and I want you to explain these Center for Medicare and Medicaid quote innovation centers, right? But the I also wanted to pull this out from your article before we go to that. You know, you mentioned about the administrative costs. We talked about the advertising. We talked about the profits that's going to these middlemen that have no reason for being there. But also, in 2020 alone, these companies, these Medicare Advantage companies, exaggerated risk scores of patients and generated $12 billion in overpayments. In addition, these Medicare Advantage companies routinely deny care. And so there is this is hurting seniors, this is hurting taxpayers. This is just not a good deal to privatize Medicare or Medicaid. And so, that you mentioned that inserted into the passage of the ACA was this language that created a new agency. And it's called the Center for Medicare and Medicaid Innovation. And so, wow, Ed, innovation. That sounds. What's wrong with innovation, Ed? Are you
exactly?
What's your deal?
I think that again, the prostitution of our language, to the extent that they're able to use things that give a connotation that this is positive. So people say, oh, you're exactly right. That's why they named it this. And if you're smart enough, which I think most people are, you have to say, well, why are all these innovative, quote, programs all privatizing programs? Why don't they have a pilot program that talks about the need of expanding Medicare for everybody, saving money? Because the whole essence of the people running the Congress and running this whole show is not to provide Medicare for all with a cheaper system. It's to ingratiate themselves literally to the insurance companies who are really running the show. The private insurers are running the show. They see a lot of money. In fact, the Medicare Advantage insurance companies make more money off of Medicare Advantage than they make off of selling traditional health insurance. So what does that really tell you? That we're basically subsidizing these corporations, these literally parasitical corporations, who then come on the idea and say that, well, we're innovative, we're saving money, and it's just not true. As you just pointed out, $12 billion, and you can go through some of my links and do your own research on a lot of the money that has been found to be misappropriated. They aren't even going after and getting. They're not even seeking money. They're not seeking penalties, not seeking fines. It's just, I think that it's like a teachable moment. You have Southwest Airlines just walking away and say, ha, 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 and you have all of these criminalities associated with the system. And yet, instead of having an upsurge, instead of having a popular alternative vision put out there by either the Democrats or even the top unions, you really have silence. So people are confused. They have nowhere to go. They're disoriented. They're kind of like figuring out, well, who is on my side? And I think what we're saying, or I'm saying, is labor has a classic opportunity here to resurrect its real mission. And if they don't do it, you're going to see that it's just going to be a further downward spiral of everything. Because either we have an alternative look at what's going on, or the wolf is just going to devour the system. And like, I'll give you an example. In Canada, almost the same thing is going on. In Canada, they're arguing in Ontario, at least, that they're privatizing the healthcare system. They're underfunding the healthcare system. And labor unions in Canada literally are holding big rallies, and they're pushing their leaders. They're at least articulating the problem. And here we don't have anything. And, so it's up to us. You're the union. Remember the old days that say you were the you in union. Right. Well, either you do it or you could just ignore it. Just put your head in the sand and just ignore it, or point fingers at somebody else, I hope.
Yeah, well, Ed, you're saying that Democrats haven't been loud enough about this. The labor leadership hasn't been loud about this. But now, the Republicans just got the speakership, and I understand that they really hate corruption, and this sounds pretty corrupt. You're not anticipating that the Republicans are going to do something about this?
No, I think that there again, it's a teachable moment for us, that if the Republicans, like you just said, demagogically, they'll rail about anything, but will they actually do anything? Well, I think we ought to, you could hold their feet to the fire Like you could go to the Republicans and say, here's $12 billion of corruption. Why are you doing this? And, and try to change the terms of the debate. And I think that's really what we have to do. And that's what we're trying to do. I mean, we're just trying to, and there are some labor councils that have passed resolutions, and it's all in the, we're trying to create a new alternative to fight this. And I think once the public would become aware of it, and see, that's the role of labor. Labor has the resources, labor has the potential power to do it. And it has to assume that role, but it can't assume that role if we don't have an organized plan. And this is the first part, is hopefully doing what we're doing now. And yeah, the Republicans, I mean, what can you say? You have to just use, but it's also, you can shrug your shoulders and say, well, why aren't the Democrats doing it either? They're not really saying anything either, So we have a plague on kind of both your houses.
Yeah, and this ACO reach, you say in your article that this, and this is one of these quote unquote pilots.
Yes.
That was established under here. You're saying that this program auto-enrolls beneficiaries who have selected traditional Medicare into a privatized program without their consent, and that these programs can actually be eligible for profits of 25 to 40%. How is that possible that they're enrolling these people who want traditional Medicare into a private plan?
Well, it is kind of, and they set it up to be complicated, so I'll try to simplify it. So I'm in traditional Medicare, and I have a personal primary care physician. If one of these ACO REACH programs can go to my PCP and tell my PCP that we'd like you as a doctor to enroll in this program, we'll give you certain incentives, we'll give you certain benchmarks that you should be following, and that, if you think about healthcare, there's really not much to save except by denying care. Either you deny care where it's necessary, or you can't make really a profit. So that's kind of like where it's all at. They'll take a PCP without the knowledge of the beneficiary and say that, we'll help you, the doctor, manage Ed's care or Jacob's care. Manage meaning controlling where he or she could go, and then they might have a network. And they have told people who protested this that they'll say, well, you know what? If your doctor has decided to go into this program, Ed, all you got to do is go find another doctor. So you're not really forced into this. But the reality of it is that depending upon the age of people, depending upon their physical location or geography, depending upon the ability to get another doctor, it's just another almost insurmountable hurdle that people will face. Mm-hmm. And all of this is done to as I said, to provide profit for these entities, which again use the argument, hey, we're going to save you money. We're going to save you money. We're going, and the reality is that any money saved is usually just part of their profit. So it's very insidious, and it's just wrong. And I could get back into the Medicare Advantage scam, because you have this ACO REACH, which automatically would enroll people without their knowledge. And then you have the Medicare Advantage program, which the government has set up codes. And so that you have to know how that scam works. And the New York Times did a good article exposing all of this. It's pretty simple. Basically, what they do is they say that if you want to get into a Medicare Advantage plan, we pay differently. Whereas with traditional Medicare, you go and you get services and the provider is paid. With Medicare Advantage, they get a lump sum of money per recipient. But how do they know how much money to get for a recipient? What they do is they get an opportunity to code your physical health. And the messaging here is it's ripe for corruption. because they'll insert different codes. They'll say, well, Ed Grystar has this problem, he has this problem, and they'll upcode it so that instead of getting $5,000 per Medicare recipient, they may get $25,000 or $30,000, and then any money not used is their profit. And this is all documented, and it's all out there, and it's all been associated with part of the $12 billion in overpayments. Yet some people in Congress say, well, you know what we have to do, Ed? All we have to do is shut down the bad actors, the real bad thieves. We'll leave some of the ancillary thieves there. And our whole point is the whole essence of it is wrong. It's just because why? You go back to 1965. That's why Medicare was created as a single payer system without profiteers. I think.
Well, the response from labor to this has been, you point out two different polls, but I mean, really the, definitely the weight of the leadership is really behind one. And in one poll, you're showing that, and this is, I want clarification here. In New York City, retirees have had to file lawsuits to stop their own leaders from changing their coverage from traditional Medicare with a supplement to a Medicare Advantage plan. Is that their own leaders? Is that unions or their own city leaders?
Well, I think that it's both. So number one, when you have Medicare, because the weakness of initial Medicare, it only pays about 75 or 80% of the cost. So people traditionally in the past, what they've done is they have gotten a supplemental plan. Okay, that's what I have. You have to go and purchase another supplemental plan to cover the things that Medicare doesn't cover. Now, that is an expensive or somewhat expensive, and as healthcare costs go up, those costs go up depending upon your age and depending upon where you live. So like right now, I think I'm paying $140 a month, which is a substantial amount of money.
Wow, that's more than I'm paying.
Yeah. So if you have a supplement, you then get coverage on the things that Medicare doesn't. You can go to any doctor, and that's how that works. And that worked kind of seamlessly for many people. But the people who just are retiring, many of those people in their union contracts, the employer 25 years ago or whatever, 10 years ago, 20, 50, whatever, they paid the cost of the supplement. So they had good health care up until they retired. And then when they retired, people said, well, how do I continue to pay my health care costs? Because it may be $100, $200 a month, as I just told you.
Right.
What was negotiated was the employer would pay that Medicare supplement because in the past, it wasn't that much of a financial burden. And there was only a limited number of people that got it. So as the cost rose, the employers would say, well, what the hell am I paying your supplemental cost? I'm just going to go out and force you into a Medicare Advantage plan that, guess what, is literally subsidized by the other taxpayers. Mm. And of course, the Medicare Advantage plans has all the negatives. They have to have pre-authorizations. They limit care. And they use this argument with the cities, the municipalities. This is going on in any employers. They use the argument that this costs too much money. We should just shove you into a Medicare Advantage plan because the Medicare Advantage plans are cheaper. Why? Because they're subsidized by the taxpayers. So you have like this vicious circle, and the unions then are in the kind of a position where they throw their hands up and they say, well, what are we going to do here? And so then the retirees are saying, well, I'm going to potentially get worse coverage. I should have this. And that's the essence of it. And the whole argument that we're making is that the insane corruption should be ended, and you could provide everybody with better health care.
Right.
Well, because, and I hope that answers it.
Yeah. And then and in addition to that, you say that the Alliance for Retired Americans, which is the AFL-CIO's national retiree organization, they haven't issued any statements about that. And you also say that activists around the country are reporting that they're being cautioned by the Alliance for Retired Americans to not call for the cancellation of the ACO REACH privatization program.
Well, that's because if you like again, this is getting a little off the weeds, but I'll try to explain it real quickly. It's like the ARA is the official retiree organization of the AFL-CIO. The national AFL-CIO sets the policies. At this point, because they're so weak, maybe I shouldn't go there, because they're.
Well, no, I mean, I think that's accurate.
They haven't issued any critical analysis of this program, ACO REACH, privatization of Medicare. What they're saying is, you know what? Hey, our great friend Joe Biden, who just broke the railroad strike, he's the most pro-labor person in the world. Guess what? He doesn't want you to be bitching about the ACO program. We have to analyze it. And that's literally what they're saying. So the people in the lower echelons of the ARA, these grassroots groups in each of the states, some of them are starting to say, well, we heard presentations and would like to know more about this. Why don't you do anything? And their answer is just what I said. Hey, you as the lower echelons can't be making official complaints because we, the top people, control what the policy is. And so what all we're saying is that rather than them lead the fight, they're literally damping it down. They're pushing down on it when they should be pushing up. Right. And
you say that there are labor organizations across the country that are pushing back.
Yes, and I think that's the positive, and there's a positive and negative in almost everything. So in this case, you do have people, once they hear it, once people explain it to them, they're saying, well, what the hell is going on here? This is not right. And I think that's really what we need to have in the labor movement. We need to have a groundswell of people from the bottom to push a new paradigm, because each day it's clear and clear what's needed and what we don't have. And the existing structures can't provide it. They simply can't provide it. They're not capable of providing the necessary leadership, yet it's right there in front of us. It's right there. It's ready to be fought for. But people have to come to grips with it. They say, well, I don't want to do it. Well, you know what? If you don't want to do it, then it ain't going to get done.
Yeah, that's exactly right. And we can answer this question from the chat from David Story, friend of the show, co-founder of the program, actually. And this is a bit off topic but I think that we've gone through the privatization of Medicare conversation, and he had a question about, you're an advocate of Medicare for all. I am as well. And he said that I'd ask Ed what he'd say to convince older unionists like myself that have watched neoliberalism decimate our social programs. How can we trust the same government to do what's in our best interest with respect to Medicare for all? And I guess, and I'll give my thoughts, and Ed, you can think about it as well. But my thoughts would be basically that in addition to neoliberalism decimating social programs, like we've been talking about with Medicare, this whole program, the same thing has been happening in our union contracts. And Ed, I think you could speak to that just as well. You've been negotiating contracts, and healthcare is a very big portion of union contracts, and the same thing has been happening in our union contracts, is that healthcare has been getting worse, Medicare has been getting worse, it's all been getting worse, and the antidote to that is the same way that we got Medicare in the first place, which is a powerful organization of working people, powerful labor movement, militant labor movement, pushing back to get things like Medicare, to get things like good healthcare in our union contracts, and I think I would just think that it would be easier to maintain a Medicare for all system nationally than it would be for everybody to maintain good health care in all their individual union contracts. And that would be my kind of initial thoughts about it, just because it affects everybody the same, as opposed to you as an individual workforce going against this company or at a work site or even, industry wide. Instead of that, you've got the whole of the country that will be agitated by a change in your insurance, as opposed to just your workplace and being able to pick you off that way.
Yeah, you that's it. I mean, that's pretty much it. It's like, that's why when people say, we need a change in the way people are thinking, that's pretty much it. If you have individual contracts, thousands of insurance companies, thousands of individual contracts, you get people pitted against each other, and one insurance company, one union. And if you have everybody in, you would have a much greater benefit. I mean, this is where people who have union contracts, and they say, well, you know what, Ed, if I had Medicare for all, I'm going to lose my benefits. And it's like, we interviewed a congressperson from Western Pennsylvania who said, well, I don't think I could really support Medicare for all. And we said, well, why not? Well, some people have benefits under Medicaid, literally Medicaid, which is even lower than Medicare. And I don't know whether if we had Medicare for all, they would continue to get those benefits. And it's just like just skimming over reality, because most people don't have 70% of the benefits that would be in a Medicare for all plan. For instance, long-term care. Who has long-term care that people now literally have to go bankrupt? You have to be poor to put your relative or your family member in a nursing home, and then the coverages are bad. And if you had Medicare for all, as you said, everybody would be in the program. There would be a natural push from the public to maintain quality services. And so you have all these other hearing, dental. What kind of a society claims that dental isn't related to healthcare? It's just crazy. I mean, but nobody speaks up to that. And I think that's what, if we had people speaking that way and unions fighting for this. Remember, 10 years ago, 12 years ago, we had 600 unions supporting Medicare for all. 600. And where are they at now? What are they doing? And I think we have to realize that the public is with us on this. And what we lack is literally a political direction. And it's programs like this, hopefully, that people will listen to. And we have to get out there and just organize. I mean, I guess I'll end it by my last organizing drive with PASNAP. I will never forget it in that people came to the union meeting. The nurses came to the union meeting, and they said, hey, Ed, what is your union going to do that's different? The same people are going to be in the union that you're going to represent us with, and they won't do anything now. They won't fight for us. They're apathetic. And I mean, my point was, if you had the right leadership, if you had the right alternative direction, if you had a different vision, you could create so much energy that you could push things away. And that's really what is needed. And it's possible. History shows it's possible. And to be different, like the crackpot Republicans today, everything they're fighting for has no impact, literally almost, on the average citizen. But if you had people in Congress fighting for our issues, you could create a huge groundswell of support.
I just wanted to piggyback on those comments and echo those sentiments from both of you guys. And it's my belief as a unionist that the American labor movement must come out strongly and in a united fashion to declare that healthcare is a human right. And it's an international disgrace in this country that we don't guarantee healthcare. And I think labor unions have a huge role to play in pushing for a form of single-payer healthcare, whether you call it Medicare for all or not. The truth is, every single person deserves healthcare, deserves dental care, deserves vision care, right? Deserves long-term care, not because of a contract, not because of anything beyond the fact that they're our fellow human beings, and we're the wealthiest country in the history of this
Yep.
planet. And if we can do anything, we can take care of our people.
Yeah.
And it's a shame that we have folks in leadership and in some elements of the labor movement who've forgotten that it's supposed to be a movement. Right? Not just institutions that you sit on top of and that you ally with other folks who sit on top of other institutions, but a bottom-up movement representing rank-and-file working-class people. And I think that if we can build the sort of coalitions that we built in the 1930s and in the 1960s, where we see the fusion of street power, social movements with a organized and militant labor movement, that's what it's going to take in this country to guarantee health care to our folks and to do so much more that we need to do. So, yeah, I appreciate your comments, both of you guys, and I appreciate the work that you're doing on this subject, Ed.
Yeah. Ed Grystar is, the article is Labor Leaders Provide Cover for Privatization of Medicare. It is in Counterpunch. He is co-founder and current chair of the Western Pennsylvania Coalition for Single-Payer Healthcare, former president of the Butler County United Labor Council in Pennsylvania. Ed, thanks so much for taking the time to talk to us this morning. I appreciate it.
Thank you very much. I appreciate it. Good luck
Absolutely.
to you.
Appreciate it.
Thank you.
You just saw a clip from the Valley Labor Report. We are live every Saturday morning from 9:30 a.m. till 12:30 p.m. And we pride ourselves on keeping all of our content free to everybody so that we can talk to as many working folks as possible. If you support the work that we're doing, you think that it's important, you think that it's good, then consider making a monthly contribution to the project, and you can do that on our website, tvlr.fm.